welcome to our webinar this evening. We are excited to welcome you to this event tonight, which is all about your oral microbiome and whole body health. This webinar is about what you need to know. It's presented by Dr. Paul Rollason, Principal Dentist of Absolute Dental Care. So, before I hand over to Dr. Rollason this evening, I have a few admin items to cover off on. First of all, we absolutely welcome a lively chat. However, please remember that whilst we can't see you, we can see you typing in the chat. So we want to make sure that you don't reveal any medical information within the chat, because we want to make sure that your privacy is maintained throughout this session. We need to treat this like we would a public forum. Now, before we begin, please be advised that the information presented during this session is intended for general informational purposes only. It's not a substitute for professional advice. And certainly, if you do have more questions or more information that you would like to discuss in regards to medically speaking or anything related to your oral health, then please book an appointment to see Dr. Paul and his team, and they will be able to help you directly. Now, we'll be offering you the opportunity to ask questions live, so please pop your questions in the chat. Again, you're welcome to share your questions with everybody who's on the call, or you can also just send those questions to Paul and myself, and we will endeavour to answer those questions at the end of the presentation. I'd like to now introduce you to Dr. Paul Rollason. He was born and raised in Brisbane. Dr. Paul knew he wanted to be a dentist in grade 6 when he met and grew to admire his orthodontist. And the idea of working with families and being hands-on with patients was very appealing, both to his personal connection with people and his interest in dental science. And he was actually told in grade 7 that he wouldn't be good enough to be a dentist, but he's never been one to turn away from that challenge. So he set about finding his ways to pursue his passion. Paul started working at the practice at Absolute Dental Care as an associate in 1996, and he managed the practice for about 10 years before purchasing it in 2006. So nearly coming up to 20 years there, Paul.
Oh, yeah. It's been a while.
Absolutely. Now, welcome, Paul. Everybody is here to find out about this fascinating area of the oral microbiome. Let's get started.
Excellent. Well, welcome everybody to this little session tonight. This is a little bit informal, but we'll go through some interesting statistics about some microbiome and the confusion that's around, and why it's really important that we have a look at this and examine that as part of our regular examinations as part of dentistry. Unfortunately, a lot of my colleagues don't do that as yet, but this is becoming more and more popular, and certainly in the United States, and there's a big trend in Australia starting this way to really assess this to make sure that our patients are fully looked after. So what are we going to go through tonight? Well, the aim of this is to really understand what a microbiome is, have a look at the difference between healthy and unhealthy microbiomes, also recognize the importance of what types of bacteria and the consequences that we have from that. We'll also look at the link between the oral bacteria and our systemic system. In other words, basically the rest of our body and the health of our body. And we can also then discover how we can help you maintain that balance and give you some strategies to use at home to make sure we keep that balance. Now, some of those strategies at home are only if we need to go down that track, because if you've got a healthy biome, there's no point in actually changing that whatsoever. So let me just get the next screen up here. Okay, so what is a microbiome? Well, a microbiome is really a collection of microbes, and that can be anything from bacteria, funguses, and viruses. And we've all got these microbiomes, and we have good microbiomes and we have bad microbiomes. And once again, not all microbiomes are bad, because we have good bacteria in our bodies, and we need that microbiome in our stomach and our intestines to make sure we function correctly. When we upset that microbiome, sometimes we will get some upset stomach. We can have diarrhea and those sort of things. And quite often, when we had a lot of antibiotics, we wipe out the good microbiome in our intestines, and then we, basically sit on the toilet for a little bit until that microbiome comes back. And that's where things like probiotics and stuff like that will help put put the good bacteria back in. But on the flip side of the coin, we're concentrating tonight on the not so good microbiome and what we can do about it. And microbiomes are really, really, really quite tiny. They're microscopic, and the only way to look at that is underneath a microscope, and we'll see some examples of that tonight. So how does the microbiome affect your overall health in your body? Well, in the mouth itself, the bacteria sit around our teeth and cause a number of problems. We can certainly get tooth decay and those sort of things, which is the obvious things that happen in dentistry. But because your gum's a bit like your collar or your cuff around your shirt, it's usually quite firm and tight. When the bacteria gets around those, it can soften that collar and it starts to bleed on us, and that's inflammation. As that collar gets softer and the bacteria then burrow away in these nice, dark, warm, moist little areas beneath our gums and around and underneath our tongue and other places, it can actually stagnate away, and it can actually cause further inflammation, causing the gum and the bone then to pull away from the tooth. And that's gum and jawbone disease. More gum and bone that's missing from the tooth, teeth become loose and they fall out. But that doesn't just stop there. We have some systemic issues as well. Those bacteria, and particularly the really nasty bacteria, and I'll go back one step, we have those good bacteria, and we want those good bacteria in low numbers, but the bad bacteria we want to make, bugger off and get them out of there as quickly as we possibly can. And those really nasty bacteria dump a lot of toxins into our bloodstream, as well as the bacteria themselves getting into that bloodstream, and they can circulate around and they can get into things like the walls of our arteries and our heart, into our brain and other organs, and it causes inflammation in those organs. And that can actually lead to a 2 to 4 times increased chance of getting heart disease and stroke, diabetes, Alzheimer's disease, bowel cancer, pregnancy problems for you ladies, such as a low birth weight and early childbirth. We can get bowel cancer. And there's also links now, there's very strong links to suggest that we get arthritis as well. And there's also links to cancer. And some of the biggest research into cancer at the moment is looking at what the microbiome has on our body. And the current theory is that because your body's trying to currently or consistently trying to fight these bacteria, it's lowering your body's immune system to be able to fight other things. And that's where we think that it allows the body to be more susceptible to the normal things such as precancerous cells, and that's where the concentration of the research is at the moment. And it makes perfect sense why one person can have something wrong with them and the next person can't, and they live in the same environment. They also think now that combination with that and things like preservatives from food can have a dramatic effect on that microbiome and how our body's immune system behaves. It's moving along. So how can we test the microbiome? Well, what we do is we actually take a physical sample of from your mouth. And we do that at every one of our regular comprehensive examinations that we get people into. So commonly known as an exam or a checkup. It's a lot more than that, because obviously we're not just looking at the teeth, we're looking at the bacteria, the health of the tissues and everything else. And taking a sample of that bacteria is now highly important to find out what our risk is. So we basically go in and take a little tiny scraping off the back teeth, right on the gum line, put it onto a microscope slide. We put it up on have a look under the microscope, and then we put it up on the screen to show our patients what types of bacteria that are around. And we also then can treatment plan from there and figure out what the next step is. Some people have got a good microbiome. We can just walk away from it, and that's fantastic. We give the patient a pat on the shoulder and go, keep up doing what you're doing. If there's some really nasty bacteria in there, then we need to modify the way we do things. And that's a two-stage approach. It's not just us cleaning the teeth on the day or completely disinfecting your mouth, because obviously if we don't get rid of all the really nasty stuff, then it's going to come back fairly quickly. And there's some at-home procedures that we get the patient to do as well. And we'll talk about that a little bit later. The most important thing about this is just part of our normal examination, and there's no out-of-pocket expenses to the patient. We usually do, well, we always do it at either rebate only or no cost whatsoever to you. So it's basically completely free for you. So really, what is a high-risk patient? Okay, and this is one of the slides from one of our patients. This is a 21-year-old female, fit and healthy, fairly good oral hygiene. She brushes twice a day, has minimal plaque buildup in her mouth. She flosses. She has celiac disease, and she is immunocompromised as well and immunosuppressed because of her other conditions that she has. But overall, when you look at her mouth, it looks quite good until you take this sample. And I'll just hit the little play button on this. If you have a look at these little bacteria that are around there, the little tiny black dots that are in here, they're what we call cocci. And cocci are in the normal parts of our microbiome. And we actually need cocci to survive. If we don't have that, then all the other nasty things such as funguses and other viruses can overtake, and we get very ill very quickly. So this keeps basically the status quo in our body. There's some longer ones in here. They're a little bit harder to see because they're moving fairly quickly. These little straight ones that are in here where my little pointer is in the moment, they're called rods. They're okay. We can deal with those around the place as well. But these little squiggly wormy ones that are in here that you can see right around the screen, looking like a bit like a corkscrew, they're called spirochetes, and they're quite nasty. These really fat little dudes around here, you can see where my one is now, just around the end there, and they're moving quite quickly. They're called vibrioses. They're also quite nasty. And these are what they call anaerobic bacteria. So the spirochetes, the triclamads, the vibrioses, and the amoebas are the four really quite nasty ones that we have around, and they're the ones we've got to get rid of. And anaerobic bacteria live in the absence of oxygen. So they love to live in the corners, underneath our gums and whatnot, and very hard to get to. They can stagnate and breed away around there and dump all those toxins and whatnot into our bloodstream, causing some havoc. We move to the next slide. This is a moderate risk patient. This is a 56-year-old female that we have in our practice. She's reasonably fit. She brushes twice a day. She flosses every day. She's slightly elevated blood pressure, but she works in a nursing home. So we see some really good in her mouth. It looks fantastic, but you take these little samples and they're showing some activity that's in there. Once again, the little tiny black dots that are in here are the cocci. These longer ones are in here are called rods. They're really difficult to see, but there's some little vibrioses floating around the place as well, and a couple of spirochetes. As you can see, it's not as bad as the previous patient, but certainly bad enough that we need to intervene. Moving to the next one. And this is what we call low risk, okay? Now, everyone's going, oh, heck, there's a lot of dots on this little screen. But if you have a very careful look, that these little tiny black ones in the background are moving, and there's not a lot of movement, which is what we want to see, okay? So, and there's a rod here and there's a rod there, but there's no really nasty bacteria in there. And this is a 43-year-old male, healthy, brushes about once a day, very rarely flosses. There's very little plaque in his mouth, and he's generally healthy. So we're very lucky in his mouth that he is low risk, and we don't have to do anything else other than get him back for his regular examinations and his disinfection once every 6 months. So he's low risk. So what can we do? Well, in the every patient that comes in and after we've taken the bacterial sample, we then stain the plaque or stain the microbiome in the mouth. And you can see on this patient here, you can see the purple that's around his teeth there. So that's showing up where the plaque is. Obviously, where there's no purple or pink, that's where it's clean. Okay, and you've probably quite often seen those red disclosing tablets we used to have as a kid, and used to see pink bits around your mouth and on your teeth, and you had to go brush them off. Well, this stuff is our version of it, and it's on a bit of a material on steroids, if you like to look that way, and it gives a much better, definitive suggestion of how much plaque is around. So the really light pink areas means there's very little plaque in there, and the more purple it gets and the darker it gets, that means the plaque's been there longer. And if you have a look down on the bottom of this person's teeth, you can see how there's really dark purple, and some of that plaque has been there for about 5 to 7 days. On this one down here, see it's very light pink around the place. That's usually 1 or 2 days of plaque that's around the place. And this is not too bad, but we just need to get the patient to modify their brushing to be able to get into these other areas. What do we do in the surgery? Well, one of the things we use is this lovely little machine called an airflow unit, or an EMS airflow. It's God's gift to every hygienist and every dentist around the place. It's certainly made disinfecting our mouths so much easier, much more comfortable for the patient, because guess what? It heats the water as well, and it uses a little powder that's in this little cylinder in here, and acts like a miniature sandblaster. And by that, we can strip all the plaque off the tooth very, very easily. We can actually strip the plaque off the gums as well, not stripping the gums off, but stripping the plaque off the gums. It can tidy things up exceptionally quickly. It can get just beneath the gums, but more importantly, it gets into these really hard to get areas around the place. And that's really quite important, because a lot of the traditional areas of what we used to call just doing a prophy with a little prophy cup never got into these areas anywhere near as well as what this EMS airflow does. And the good thing about the EMS airflow, it also gets rid of stains as well. It's pretty cool. And once again, every dental hygienist craves to use one of these little units. What else can we do? Well, the other most important thing is that we need everything, that even though we clean it all off and disinfect everything in the mouth within the surgery, we then have to make sure the patient gets rid of this stuff at home, because we can't get rid of 100% of that bacteria, particularly the nasty stuff, whilst you're sitting in the chair. It just doesn't happen. So one of the most important things that we do is this material called peroxyl, which is readily available from Coles and Woolworths and chemist warehouses and all those sort of places. Peroxyl is a peroxide-based mouth rinse, and it is exceptionally effective. And we use this whole procedure as part of what we call the Larkin protocol. And the Larkin protocol was invented by a guy called Tom Larkin in the United States, who's highly respected for putting all these little bits and pieces of information together that we've all learned as dental students, and putting it together as a package and a protocol to make sure that we treat our patients appropriately. And certainly the looking underneath the microscope and diagnosing what types of bacteria is a key component to that. From there, we get the patient to use this peroxyl for the moderate to high risk patients. We get them to use it twice a day after brushing, and then we review the patient in three months' time if they got these nasty bacteria. And then we get you back to see how well you've done. Can we modify things a bit more? Do we need to keep going? And I'm really pleased to say one of those patients that we saw, that high-risk patient before, the 21-year-old, today had an enormous change. In fact, there's very little of the nasty bacteria in 3 months, and that's a pretty spectacular view. Mind you, this can actually be, it depends on how well you get rid of it. It depends on how well you clean at home, how vigilant you are about cleaning things off, and dedicated to the process, and using other things to also help us clean. And one of those, obviously, brushing twice a day is exceptionally important to reduce the amount of bacteria in the mouth. Obviously, what we call interproximal cleaning, or cleaning between the teeth, is essential, because when we brush, we only clean 3/5 of the tooth, because the toothbrush does not go between the teeth at all. So it's a bit like washing underneath one arm, but not washing underneath the other arm. That's pretty foul. So by cleaning in between the teeth, we go and clean a lot more of that bacteria off. Some of the ways we help clean in between the teeth, we use little interproximal brushes called pixters. They're God's gift to everyone at home. They're like a little tiny bottle brush to get in between the teeth, and that physically removes the plaque. Simply rinsing alone does not get rid of all the plaque. And I can liken that bit like when you go and you take your four-wheel drive and you run it through the mud or whatnot. If you just hose the car, you don't get rid of all the mud. Okay, you then have to take a sponge and get rid of it. Same as our dinner plates at home. If we just rinsed it underneath the tap, we don't get rid of all the bits and pieces on our plate. We've got to get the sponge as well and clean it off. And that's what brushing and flossing does. And unless we clean that in between the teeth with the floss or the pixters, that stuff, the bacteria and the microbiome continues to stay there. We then obviously use the peroxal mouth rinse after brushing and flossing, and that goes around and starts to mop up the little bits that are left. So once again, it's a bit like cleaning your plate at home. You've given it a bit of a scrub, you put it in the dishwasher, and now you're going to cook things at a much higher temperature with a lot higher with detergents as well, and that kills off some of the bacteria that's in our dishwasher. Well, once again, the mouth rinse will do the same sort of thing in your mouth. Other ways we can help that along is using laser disinfection, okay? And this little picture up the top here shows one of our little lasers. We can actually get down into these deep, dark pockets where it's really difficult to get to. We only ever go down that track if we have to. If the patient hasn't quite succeeded at home, one of the next stages to do is laser disinfection, and we can get in there. Another really neat trick that we can use along the way is actually whitening our teeth. And believe it or not, the at-home whitening kits, and you can see the Polar White or the Polar Night that's here, by setting up some little trays in your mouth, like miniature mouth guards, we can not only get your teeth white, but because this whitening gel is actually peroxide based, and you're wearing for 2 30-minute sessions a day, it's a really neat trick to get rid of the bacteria more efficiently, because we're holding that peroxide against the tooth for 2 30-minute sessions at a time rather than 30 to 60 seconds twice a day. So we use that for a lot as an alternative treatment for the really stubborn bacteria that we can get rid of. Not only can we help that, but there's other things we need to look at of why we actually get some of these bacteria and where do we get it from. Well, there's a number of places. One, we can get it from our parents. And certainly we pick up a lot of bacteria from our parents. And sometimes that bacteria lies dormant for a long period of time. As we get run down, that bacteria then can take over, and then it's very difficult to get rid of. The other thing is one of the most important things is improved hand hygiene. Okay, because obviously we're touching stuff, when we put fingers in our mouth and so on and so forth, we can pick stuff up from absolutely everywhere. Contact with pets is another big one. Okay, particularly people who've got dogs and cats, we see a much higher risk in these people because they've got a lot of these anaerobic bacteria floating around their mouth. And when you think about it, why do we get it from dogs and cats? Think what they do with their mouth. Okay, they chew things in the garden, they eat other poop in the garden as well, they lick certain parts of their own body, and if you allow the dog to then lick you, you can transfer that bacteria to you. So hand hygiene is exceptionally important. And one of the things we need to really consider with our pets, we love our pets trying to kiss us, lick us on the face. Best way in the world to get the bacteria into your mouth. So we just need to be a little bit cautious about that and conscious of what's happening, at least anyway. And once again, improved hand hygiene and discouraging your dog or cat to actually lick you. The other most important thing for keeping it down is regular appointments. Now, that's not a big sell for dentistry or anything else like that, but you and I just can't get rid of every part of the nasty bacteria and the calculus and the other microbiome that builds up in our bodies. And even I've got to sit in the chair and I've got to let my hygienist and get in there and get rid of some of the bits and pieces that I can't, and give me a kick up the backside on the little areas where I haven't quite got to. And we all do it. And if we just modify that technique of how you brush and where you're brushing and get that regular hygiene up, it's all good. How often should that be? Well, it should be a minimum of every 6 months to get rid of that calculus and microbiome buildup that we all get. But obviously, the higher risk the patient with those nasty bacteria, quite often we have to get the patient back every 3 months till we get rid of it. And we've been quite successful in getting rid of that. Sometimes it's a bit stubborn to get rid of, and it takes a lot longer than that. And that's usually something else in the environment that continues to re-inoculate those areas. And that's a matter of identifying what those little areas are to be able to, make the improvements, if you'd like to look at it that way. If after a couple of times we don't get anywhere, well, that's when the laser disinfection and the at-home whitening is an option to kick it in the pants that little bit more. Some other interproximal cleaning that you can do at home is using things like water flossers, like There's Waterpik and Hydropick are the two best ones that are on the market at this particular point in time. And those are a little bit like having your own miniature gurney at home, and to be able to get in between the teeth and really flush the rubbish out between your teeth. Very similar to the MS airflow that we use in here, obviously, but this stage is just water only at home. You don't use the little particles like we do, because if you use that in the wrong way, then you can strip gums off teeth very easily. So the little water floss is great for getting between the teeth and blowing out the stuff between, the food buildup and the extra bacteria there. And if you loosen it between the brushing and the flossing and then use the water flosser to get rid of it, it gets rid of a lot more of the buildup. Then when you go and rinse with your peroxal mouth rinse, it then kills the last little bits and pieces that are lying around the place. It's a really good way of doing it. And most of our patients are absolutely astonished. They think they've brushed and flossed really well, and they use a water flosser and between their teeth, and they find out how much more garbage comes out. And it's really quite astonishing. So realistic, where do we go from here? Well, if anyone ever wishes to have a look at their microbiome, they're certainly more than welcome to come and visit us, and we'll go put them through their full comprehensive oral health assessment, or commonly known as the old term that used to be an examination or a checkup. And we make sure that we look at all this for you and then come up with a plan of what's best for you, because it's not just a one-size-fits-all approach, and we're certainly happy to help people. And it's been quite pleasing to the people who have been quite ill for long periods of time and they can't get on top of their normal health. You start to tidy their mouth up and lower that risk. It reduces the risk on the rest of the body, and quite often things start to improve. Diabetics and people with heart disease are a common one, and seeing that reduce in those people is really quite good. And they start to see their sugar levels come down, and getting things under control once again is really quite exciting. And that's usually done with, in conjunction with the GP and other medical practitioners as required. But once again, the general rule is if we can reduce the risk in our mouth, we can reduce the risk on the rest of our body. And I'm sure we'd all like to stay happier and healthier for longer. And certainly if you need us, that's our phone number on the screen, and our email. The lovely reception staff, the lovely Stephanie and everybody else that's there, and Sienna, we're more than happy to book you in. And certainly visit our website as well if you've got any other questions there. And there's even an online booking as well. You can book an appointment online should you wish to. At that stage, Michelle, is there any questions from anybody?
We do have some questions submitted, Paul. So, Paul, the first question is, does the peroxide kill the good bacteria too? That's a really interesting question, actually. Does it kill the good bacteria as well as the bad bacteria?
It reduces it in numbers. Absolutely it does, but won't get rid of all of it, okay? The interesting part is that the cocci and the good stuff has a much faster turnover than anybody else or the other bacteria. So it replenishes a lot quicker, okay? And that's a really good thing. Whereas the other nasty bacteria, their turnover is a lot slower. So you're really trying to break that cycle. But that's an excellent question. The biggest problem we have in things like when we have antibiotics, for argument's sake, and that's a really good way of knocking off a lot of bacteria, it wipes out the bacteria from everywhere. And that's when it takes a long time to reestablish that balance. So what we're trying to do is reduce all bacteria in numbers, and even our brushing and our flossing is actually reducing the numbers of bacteria in our mouth. And just to segue out of this, if I give you a really good example of tooth decay, think of a triangle. There's three things in this triangle that needs to happen for the tooth decay to occur. One is you need the host. Well, you can't get rid of the host. You can't get rid of you. The second thing is you need sugar. And the third thing is you need bacteria. Well, we can't get rid of the host, as we said. We can never get rid of all the sugar out of our diet, and we can never get rid of all the bacteria out of our body. So if we can reduce the sugar and reduce the bacteria, the chances of tooth decay are actually much less. Same with our oral stomach diseases. If we can reduce the risk by lowering the number of bacteria in particular, our health improves. So once again, we're not going to get rid of all the bacteria. It's not meant to, and we'll never get rid of all the bacteria, thank goodness, because if you manage to get rid of all the good bacteria, you could potentially get a fungal overgrowth in our mouth, which you just do not want. So that's why we try to treat this thing slowly but surely over time.
Yeah, great. Another really good question here is the individual microbiome transplantable between people? For example, if you're kind of sharing utensils, spoons, or whatever, do you discourage this?
Absolutely, it is transferable from one person to the other. Certainly, kissing partners, children, whatever else it may be, anywhere you can exchange saliva, it will have a bacteria in it, and that's another very pertinent point. There's also certain sexual activities will do exactly the same thing as well, so that's something to be very, very, very mindful of as well. But good question.
Now, Paul, when you showed your slides,
Mhm.
was some kind of larger yellow spots that were on there. We've got a question about those. What were they?
They're actually air bubbles. So you don't have to worry about those. And some of the halo ones that are in there, that's a really good question. Some of the other round ones are also white blood cells. So white blood cells are very much a indication of inflammation and that your body's trying to tackle stuff. So yeah, the yellow ones with a little halo around it, they're definitely white blood cells.
Okay, great. We've got the questions coming in thick and fast here. How do the bad bacteria get from your mouth to your brain, causing Alzheimer's? Like, how does that work? I mean, I guess we think of the mouth as being the biggest kind of access point to our body. How does it kind of get to the brain?
Very easily. Just gets straight through into the bloodstream. And there's two ways that it can affect us. The bacteria produce a whole heap of toxins themselves. So the toxins are one thing that can go through and cause inflammation in other bodies, other parts of our bodies, and they're called cytokines and interleukins, and they can float around the place and cause that inflammation. But the bacteria themselves have now been shown in people with particularly chronic infections of crossing into the bloodstream. And that's when it then settles in the walls of our arteries and our heart and our brain and all those sort of bits and pieces. So the plaque that sits on the inside of your heart, and we've all heard about the plaque on the inside of blood vessels. That's basically a conglomeration of cholesterol and a few other bits and pieces, but the bacteria can sit in there very easily and cause that heart disease. The interesting one with Alzheimer's disease, the current thought is that people with Alzheimer's disease have got a higher concentration of the spirochetes in their brain, and that's those little squiggly wormy ones. And we actually know that from post-mortem when they do autopsies on people with Alzheimer's disease have a higher concentration of these spirochetes in their brain, and they think it's virtually like diabetes of the brain. It's causing inflammation around the brain. Therefore, you don't remember things as well and you lose that memory.
That's fascinating stuff.
Scary stuff.
Yeah, it's it's really interesting. Paul, we've got a question here. Do you do telehealth at all?
We can organise that, yes.
Patients telehealth. Okay, so we have a private question that's come through here. So the person that's asked that question, I am just going to drop the website details back into the chat. So please click on that website address. There's the phone number there. There is a booking link and there's also an email address listed on the website. So you're more than welcome to get in touch. The clinic is closed for the next 2 days, but Paul's got a lot of time on his hands over the next 2 days, like everybody else. So, if there's a slight delay in getting back to you, that is the reason why we've kept everybody at home for their safety for the next couple of days. I'm just having a look to see if there's any more questions that have come through. Yes, here's one. Do the bugs affect bad breath?
Oh, absolutely. Absolutely. The really nasty bacteria are the ones that give you the bad breath. Okay. So um, we actually know, but from bad breath, it is the anaerobic bacteria in particular that really can affect us. And it's not just on our teeth, it can be on the back of our tongue, and it can be down the back of our throat as well. Sometimes, obviously, bad breath comes from other areas as well, such as from our gastric areas, and it can come from fermenting food and stuff like that, particularly things like onions and whatnot. But a lot of the bacteria in our mouth will very significantly affect your breath. And I'm sure everyone has smelt someone with a bad breath, and a toothbrush and some mouth rinse will probably go a long way to help that. That's for sure.
Yeah, sure. No, that's interesting. Another question here. This person looks like they've got some aligners or Invisalign or something.
Mhm.
Does the Invisalign maintain the bugs when you take it out? Do the bugs kind of stay on there as well?
Great question. Anything that we put in our mouth, such as dentures or false teeth for those people, splints, any appliances such as your aligners and whatnot, the bacteria will grow on those unless you clean that off those items. It just re-inoculates stuff. And yes, they can grow even when it's out of your mouth, as long as it's got a bit of a moist area, it will continue to grow. And dentures are a real classic, particularly in between where the teeth are. That's where the bacteria can grow just like our own teeth. And yes, you'd really need to give those a really good clean with soap and water. Okay, we don't recommend toothpaste for those. Soap and water is a much better way of killing bacteria on those items. Obviously, you're not going to use soap in your own mouth, but certainly on those items, it's really good. And soaking those appliances in other solutions such as Sterident and Polydent. And then it's a little tablet that you drop into a little bowl of water and it bubbles away, and it actually lifts the bacteria off, but also the bubbling action is oxygen. So oxygen kills anaerobic bacteria because anaerobic bacteria don't like oxygen, and it knocks them off. And that's the same way as what peroxyl works. It is a high oxygen based material, and it releases some oxygen as it does it, and that's how it kills the bacteria quite nicely. And that's why peroxyl won't kill off a lot of the good bacteria, the cocci, because the cocci love oxygen. So that's another really good point with that. The other ways of killing the bacteria on those items is also soaking your denture or your aligners in a 5-to-1 solution of household bleach. Just the cheap, nasty $2 a bottle stuff from Coles and Woolworths is fine. You dilute it down 5-to-1 and you soak it in there for 2 minutes and 2 minutes only. It's another excellent way of killing these really nasty bacteria and stopping re-inoculating your own mouth. So that's a really handy way. That's a good question though, Michelle. That's awesome.
Yeah, fantastic. Another question here. After using mouthwash, can we rinse our mouth, or is that a negative action to do that? Like, should you be kind of rinsing with water afterwards, or?
Great question. The longer you have it in the mouth, the better off you're going to be. So the recommendation is you brush and floss, you rinse with the mouth rinse for 30 to 60 seconds, you spit it out, but you don't rinse it out, okay? And that way it'll continue to work for a few more minutes afterwards, which is really quite handy. Some people don't like the burning sensation on their tongue. That doesn't happen with everybody, but some people it irritates their tongue a little bit. My attitude is, it sounds gross, just stick your tongue underneath the tap and just wash it off your tongue, but leave it on the rest of your teeth and it'll continue to work nicely.
Great tip.
And one thing I'm going to preempt here, are other mouth rinses good? The answer to that is no. The Listerines and your plaques and whatnot will not get rid of the really nasty bacteria. It's only things like Peroxyl and Savacol, which is chlorhexidine based. Both of those are the most effective way of getting rid of the bacteria. But the reason why we've gone away from chlorhexidine or Savacol is it stains teeth quite nastily, and that's something we obviously don't want. There is one other way of killing really good bacteria, and if anyone's got ozonated water, and you can buy little ozonated machines to give you ozonate, that's another good way, because what is ozonated water? It's oxygen basically, and it kills bugs really nicely, and that's a really popular way that's starting to grow quite a lot around. And ozonated water is good for you as well.
So fascinating, Paul. We hear a lot about that kind of gut microbiome nowadays. We don't often hear a lot about what's going in our mouth. And everything you are saying seems really logical. And yeah, I'll have to pop in next time. I'm really curious to see what's in my in my mouth as well. But I'll definitely be
Hopefully it won't horrify you.
I'll definitely be showing, my kids, particularly those 3 videos, because I think the visual nature of those videos and seeing that physically, when they kind of tell little white lies that they have already brushed their teeth, and I know they haven't because their toothbrush hasn't moved. We will try to reduce them doing that, which is great. Fantastic. I think that's all the questions that we have here. If there's any final questions, please drop them into the chat. Apart from that, we do thank everybody for joining us this evening. We appreciate your time very much. I hope you've learned something really interesting about the oral microbiome. And please book your appointment in because, as Paul mentioned, there's no out-of-pocket expense for you to have that test done during your normal consult. So why not get it done and have a look and see what's in there and have that peace of mind, particularly if you are experiencing any kind of health issues that you're frustrated that you can't get on top of. This may be the key to relieving those symptoms. Paul, have you got any last words of wisdom to everybody before we wrap up the call?
Basically, at the end of the day, this is all preventable. You brush and you floss and you do all the right things, hand hygiene and everything else like that, and you can live a long and happy life. And most importantly, we can keep your teeth in your mouth for the rest of your life and have a healthy body that goes with it. And I think that's the most important thing.
Absolutely. Great words of advice. Thank you so much for your time, Dr. Paul. Amazing information. Thank you, everybody, for joining us. We appreciate you and we would love to see you in the clinic. Please make an appointment, give us a call, and we'll get you booked in. Good night, everybody. Have a great evening. Stay safe, and we look forward to seeing you soon. Good night, everyone.
Stay safe, everyone. Cheers. Bye.